Complementary response options include direct provision to populations affected by food or nutrition crises of health services, safe water, sanitation, and other public health measures to reduce the burden of diseases strongly linked to acute malnutrition. For example, diarrheal diseases, malaria, and measles. Provision of cash transfers to ensure that a household's diverse, multi-sectoral needs are covered. For example, for healthcare, household items, sanitation, and education, so as to prevent displacement of household food expenditure. Support to responsive and remedial humanitarian protection actions, where protection concerns may trigger or arise from acute food insecurity. For instance, ensuring safe passage to agricultural fields outside refugee camps, or safeguarding against abuse and exploitation at distribution points. In the Mandera district of Kenya, the Commission supported a program that concentrated on direct nutrition and food security support to vulnerable populations, whilst addressing at the same time some of the public health dimensions of malnutrition. This integrated nutrition, health, food security, and livelihoods program was based on a range of assessments that informed the design of the various activities and components. Focused assessments and investigations included milk market surveys, a household economy assessment, a causal analysis of malnutrition, a market assessment, an economic evaluation of restocking, nutritional anthropometric and mortality surveys, and a nutrition and health services assessment. The malnutrition causal analysis assessment showed that malnutrition in the area was attributed to poor household food security, poor social and care practices, a poor public health environment, and marginalization of the most vulnerable. Hence, the following program components were supported, aimed at addressing access, availability, and utilization of food, and the other indirect factors aggravating malnutrition. Nutritional support was provided to the acutely malnourished through supplementary feeding programs and outreach therapeutic programs, while simultaneously improving access to health services through supporting the Ministry of Health to provide extended health outreach. Communities were supported to detect, prevent, treat, and refer sick and malnourished children and pregnant women at risk in the most remote rural communities. Health and nutrition education was also provided on good feeding and caring practices, aimed at improving dietary practices of young children and mothers. Community case management of diarrhea in communities was also promoted. Access to food was improved through distribution of food vouchers to vulnerable households to obtain milk, meat, and beans. Targeted households were supported to restore, protect, and improve their livelihoods through better livestock production. This included training on best husbandry practices, fodder production at household level, and milk quality management. Distribution of fodder to peri-urban destitute households during the dry spell. Support and capacity building for households involved in the trade of safe milk, and animal health service delivery carried out by existing community animal health workers. While the above-mentioned program components were funded by EU humanitarian assistance, another donor financed a complementary program to support the Ministry of Health in the provision of basic preventative and curative healthcare services through existing health facilities and through the community.